What are avoidance behaviors and how do they harm your well-being? Imagine trying to enjoy your day but feeling a sudden urge to avoid certain places or thoughts. That's what avoidance behaviors are all about. They are actions people take to steer clear of situations, feelings, or memories that cause discomfort, anxiety, or sadness. Sometimes, these actions happen without us even realizing it. For example, staying in bed all day to avoid feeling sad or skipping social events because they make you nervous. These behaviors are often ways to get quick relief from emotional pain. But here's the catch: they don't solve the problem. Instead, they keep it going. In cognitive therapy, avoidance behaviors are seen as a way of maintaining negative thoughts and feelings. When someone avoids something they fear, they don't get the chance to see that their fears might be unfounded or less severe than they think. For example, avoiding a social gathering might make someone feel safer temporarily, but it also stops them from practicing social skills or realizing that they can handle social situations. This keeps their anxiety high and prevents them from learning that their worries might not come true. Over time, avoidance can become a habit that makes anxiety worse and can lead to depression or feelings of helplessness. Avoidance can take many forms. Behavioral avoidance is when someone physically stays away from places or activities they fear. Cognitive avoidance is when they distract themselves from upsetting thoughts or memories. Emotional avoidance happens when people suppress or numb their feelings, like pushing down sadness or anger. Interpersonal avoidance is when someone withdraws from friends or family to avoid conflict or judgment. While these actions may seem helpful at first, they actually prevent growth and make emotional struggles last longer. Short-term, avoidance might seem like a good way to feel better, but in the long run, it causes harm. It keeps anxiety and fear alive because avoiding the feared situation prevents the person from seeing that they can cope. It also makes people feel more helpless because they're relying on avoidance instead of learning coping skills. Avoidance can lead to withdrawing from activities that bring joy or purpose, which can deepen feelings of loneliness and depression. It can even cause more serious issues like avoidant personality disorder or chronic anxiety if left unchecked. In cognitive behavioral therapy, especially within the idea of behavioral activation, the goal is to help people face what they avoid in a safe way. This process is often called exposure therapy. It involves gradually approaching feared situations or thoughts, so the person can see that their fears are often exaggerated or manageable. This helps weaken the power of avoidance and builds confidence. Therapists work with clients to identify what they avoid, understand why, and develop a step-by-step plan to confront these fears comfortably. This approach encourages engagement in life and helps rebuild emotional resilience. In the end, avoidance behaviors might seem like a quick fix, but they actually hold you back from feeling better and growing stronger. Facing fears gradually and with support can help you break free from this cycle. Cognitive therapy uses behavioral activation to guide this process, helping you see that you can handle more than you think and that avoiding only keeps the problem alive. Facing what you fear is the key to feeling more in control and improving your overall well-being.